It's a very great honor tonight to present to you Dr. Jörg Klekamp, who is not only a great academician, but a very fine gentleman. It's been really a pleasure to get to know him a little bit better yesterday and today. But Jörg was born in Hunsbrook in Lower Saxony and attended medical school there in Hanover in 1977, where providentially the first patient in the academic program turned out to have syringomyelia. But after completing his studies and a military commitment, he applied to the Department of Neuroanatomy to write his medical dissertation, which is required in Germany for receiving a medical degree. He was accepted by Dr. Clive Harper, who at the time was the preeminent neuropathologist in Australia at Sydney University and the first professor of neuropathology. With whom Jörg worked for the next 2.5 years in Sydney, and apparently drove all around Australia and must have put on about 8,000 or 9,000 miles driving across the deserts, and extraordinary trip there. In fact, he would have liked to have stayed in Australia, but had to come back and get his medical degree. But while in Australia, he worked on morphometrics of postnatal development, and that included looking at the brains of many Aborigines. And I worked for three years in the outback of Australia, worked with the Aborigines, so I was intrigued to read Jörg's work. And it was actually very important because he found in these brains that there was a 17% less cortex. And this information was important probably in demonstrating the problems of malnutrition, in youth, and maybe alcohol in adulthood. He also found that there was increased visual striate cortex, which may have provided an evolutionary advantage to Aborigines out spearing emus and kangaroos. At any rate, his work was, the quality was such that Dr. Samy, who was chief of skull-base surgery in Hanover, was very impressed with his work and invited him to become a resident in Hanover. Now, when I was studying neurosurgery, Dr. Samy, his name was up there in the top half dozen neurosurgeons in the world. Dr. Samy was very intrigued with this notion of treating syringomyelia with a posterior fossa decompression, and set Jörg on that path to study those two problems. And in the process, contacted Ulrich Batzdorf, one of the founding members of this organization. Ulrich sent me a letter concerning Professor Klekamp, and he said, for personal reasons, I'm unfortunately not able to attend the meeting of this Gala, and I'm grateful to Dr. Fraser Henderson for agreeing to convey my remarks about Jörg Klekamp, this year's recipient of the International Excellence in Medicine Medal for the Bobby Jones Carey Syringomyelia Foundation. And he goes on to say, Ulrich Batzdorf, when Dr. Neil Martin was head of neurosurgery at UCLA in the early 90s, he introduced me to Dr. Majid Samy, who was the head of neurosurgery at the Nordstadt Hospital in Hanover, Germany. In speaking with Dr. Samy, it immediately became evident that we shared similar approaches to the treatment of Chiari malformation and syringomyelia. And yes, he was actually training a brilliant young German neurosurgeon who had a special interest in these problems. And would it be possible for this doctor to spend some time with us at UCLA? Dr. Klekamp arrived in the early 90s and spent several months with us. He immediately impressed me not only with his knowledge, but also his talent for organizing data for the treatment of these patients. Little did I know then that this would become a hallmark of his career. We became friends, and I visited Hanover professionally on several occasions. Professor, or as it is said in Germany, Professor Dr. Klekamp went on to a distinguished career in neurosurgery, practicing first in Queckenbrook, where he was head of neurosurgery for 22 years as professor. And during this time, he did publish 89 original articles and 3 books and give hundreds of invited lectures. And in the time I've known him, he's had an extraordinary influence, I think, on the Europeans and Americans. Ulrich goes on to say his publications in the area of syringomyelia, Chiari malformation, as well as spinal tumors, and he has a huge experience with them, have become world-renowned. I was fortunate to have been co-author in a number of these publications. His contributions to our understanding and management of these difficult problems has been truly outstanding. And he goes on to say, it gives me great pleasure and honor to present Dr. Klekamp as a 2024 recipient of the International Excellence in Medicine Medal for our organization. Well, before we go on, I would be remiss if I didn't read this letter from Petra Klinger, which I received yesterday, who is now a professor of neurosurgery at Brown and director of pediatric neurosurgery. And she writes, Dear York, I first met you during my residency in Hanover, Germany, when you gave a pioneering lecture on Chiari malformation and syringomyelia. At that time, these topics were not widely recognized within the mainstream neurosurgical research community in Germany. However, your persistence and meticulous documentation of symptoms and postoperative outcomes, using only commercial database software before the advent of medical records, led you to publish a series of influential papers in leading U.S. journals. This was so inspiring to me. You made me understand that thoroughly assessed clinical symptoms and patient-reported symptoms are the most important biomarkers guiding our surgical interventions and outcomes. That has been my credo throughout my professional endeavors. Your groundbreaking work was so compelling that Professor Sami, the chair of skull-based surgery at Nordstadt, frequently acknowledged the importance of this work. I will never forget that you invited me for a day to your established and internationally recognized clinic in Germany specializing in the treatment of Chiari malformation and other spinal cord pathologies. Today, you're among the small group of German neurosurgeons with a well-established international reputation. Personally, I wish I had worked with you more, truly. I congratulate you on your well-deserved recognition. I'm so happy for you. Very best, Petra Klinger. So, for your database of over 4,000 spine patients, half of which have syringomyelia, has to be perhaps the largest in the world. Your works on spinal tumors, Chiari, tethered cord syndrome, basal invagination, and your formative work on morphometrics of postnatal development are really foundational and remain so. So we're sorry that your lovely wife Ulrike cannot be here. She's a social worker, and to give you an idea of their social consciousness and kindness, they adopted a child who had health problems and have raised that child for the last 19 years. But we recognize her and her importance in your professional career. And so it's a great honor to present you tonight with the International Medal of Excellence for the Chiari Syringomyelia Foundation. Dorothy, do we have that medal? No. It's gone. Okay. Well, in other years, we had Miss America giving you this. But this is, it's not solid gold, but the Latin inscription is ad honorem Dei et utilitatem hominum, for the glory of God and the good of man. So, congratulations. Thank you very much.
Well, thank you very much to all of you, and to Dorothy in particular, for inviting me. And I'm very honored with this medal. It's not too often that, as a neurosurgeon or as a medical professional, you get recognition or acknowledgement of your work. Your family and your wife and your children, if you have them, they will think you're a great doctor, because what else can they say? But to receive recognition and acknowledgement from colleagues or from an organization, that is something that doesn't occur so often. So I greatly appreciate this honor. I have to acknowledge a number of people who have accompanied me on my way throughout my career. Majid Sami certainly started me off to some degree, but if I have to say, or have to answer the question, who was your mentor, who was your guide throughout your career, then I have to mention Rick Batzdorf. With his approach to patients, that has influenced me very, very much up to this day. And I'm very fortunate that I can actually call him a friend for almost 30 years now. So I've been very fortunate, and I'm coming towards the close of my medical career. I'm now 66 years old, so officially I'm already retired. I'm still working, but I will probably close my medical work in the not too distant future. Unlike Majid Sami, who's still in his private clinic with operations of patients at the age of 85, and I'm certainly not going to do that. So I'm looking forward to spend more time with my family and my wife. They had to they had to accept that I wasn't in the position to have that much time during my professional career. That's the surgeon's fate. But I want to sort of reverse that a little bit in the years to come. So thank you very much for inviting me, for your kindness. I very much appreciated this, and I feel deeply honored. Thank you very much.